Welcome to our video on the multidisciplinary approach in dentistry for treating a dentigerous cyst through marsupialization. First, let us understand what is dentigerous cyst. A dentigerous cyst is a common type of odontogenic cyst that is often associated with an unerupted tooth. It typically presents as a localized swelling of the alveolar bone around the crown of an impacted tooth. In this case, the 18-year-old Japanese woman had a maxillary dentigerous cyst associated with an unerupted maxillary canine. The cyst was diagnosed based on radiographic findings, and marsupialization, a surgical procedure to relieve pressure and promote tooth eruption, was initially attempted. However, orthodontic traction following marsupialization failed due to the severely lingually tilted tooth axis of the canine, necessitating a change in the treatment plan. Diagnosis: the patient presented with gingival swelling in the upper right anterior teeth region, midline diastema, and tooth crowding. A panoramic radiograph and computed tomography (CT) confirmed the presence of a dentigerous cyst around the unerupted maxillary canine. Marsupialization: initial treatment involved marsupialization, a surgical procedure to create an opening in the cystic wall to drain the cyst's contents and promote tooth eruption. This procedure was performed under general anesthesia. Orthodontic treatment: 3 months after marsupialization, orthodontic traction was applied to encourage the eruption of the impacted canine. However, this attempt was unsuccessful due to the severely lingually tilted tooth axis. Canine extraction: given the patient's age and aesthetic concerns, the decision was made to extract the impacted canine. Bone grafting: the alveolar bone was found to be inadequate after the large cyst's marsupialization, which prompted the need for bone grafting. An autogenous bone graft was harvested from the mandibular ramus to widen the alveolar bone. Implant placement: after bone augmentation and healing, the implant was placed to replace the extracted canine. The implant was stabilized with a screw-retained prosthodontic procedure to restore occlusion and aesthetics. Multidisciplinary approach: throughout the treatment, a multidisciplinary approach involving oral surgeons, orthodontists, and possibly prosthodontists was essential for the patient's comprehensive care. Collaboration between these specialists allowed for a successful outcome in terms of aesthetics and occlusion. Long-term results: the patient had an uneventful postoperative course for 7 years. A CT scan taken at this point showed that the cystic cavity had been replaced by new bone, and the implant remained stable in the surrounding bone. The case involved the collaboration of multiple specialists. The oral surgeon was responsible for the initial diagnosis of the dentigerous cyst and performed marsupialization to relieve the pressure within the cyst. In cases like this, oral surgeons play a crucial role in the surgical management of cysts and related conditions. The orthodontist was responsible for evaluating and planning treatment for the patient's malocclusion, which included midline diastema and tooth crowding. They initially attempted orthodontic traction to guide the impacted canine's eruption, closely monitoring its progress. When the traction failed, they adapted the treatment plan and recommended canine extraction. The orthodontist also continued addressing other dental issues like crowding and midline diastema, collaborating with other specialists for comprehensive orthodontic care. While not explicitly mentioned in the case, a prosthodontist may be involved in the later stages of the treatment. They could be responsible for planning and placing the dental implant to replace the extracted canine, ensuring that the implant fits well within the occlusion and helps restore proper oral function. The collaboration of these specialists was crucial in achieving a successful outcome for the patient in terms of aesthetics and occlusion. It highlights the importance of a multidisciplinary approach in managing complex cases involving dentigerous cysts, ensuring that the patient receives comprehensive care from diagnosis to full oral rehabilitation. The case also underscores the need for flexibility in the treatment plan and the importance of adapting to unforeseen challenges to provide the best possible care for the patient.